So I wanted to assure everybody that we're trying to take as many precautions as possible so that when you come into our office, you can feel safe and comfortable. We've done things like creating an in-car virtual waiting room. When you come into the office, in the waiting room, we have one person or accompanied by a family member or significant other, and we get you into a waiting room as quickly as possible. So our waiting room is never crowded. Everybody wears a mask, patients and the staff typically are wearing N95 masks, and that seems to be helpful. We try to maintain social distancing between patients and between staff members. We take care of our facility with industrial grade antiviral disinfectants, which we use frequently so that no coronavirus can stay on surfaces. And we wash our hands all of the time. My skin is coming off on a reasonable, regular basis because of all the hand washing and sanitizing that I do. We encourage our patients to do the same thing. There are three physicians now. Dr. Adelsheimer is on your left. Dr. Sally is on your right. We have 5 locations: Pittsburgh, Monroeville, Bridgeville, Washington, PA, and Sewickley. Our main location in Pittsburgh is the one that we do the procedures at. So let me see if I can go back. There we go. So why are you here, right? Most of you are here because you have pain and you can't do all of the activities that you would like to be doing. You've seen a surgeon, they've given you options of learning to live with it or having surgery, and they really don't know the alternatives, non-surgical alternatives and regenerative surgery. Regenerative alternatives that are available. Basically, you want to get more from your life than you had been getting. So today I'm going to talk about what is Regenexx, the current options in treatment, talk a little bit about interventional orthopedics, the Regenexx differences, who this is for, and our results. Regenexx is the biggest regenerative group of physicians in the world. We have 65 locations in the United States and about 7 to 10 worldwide. We're an alternative to orthopedic surgery. We use interventional orthopedics as our benchmark. We use your orthobiologics. By that I mean your stem cells and your platelets. We provide treatment through advanced regenerative medicine, and we've become the trusted alternative to orthopedic surgery. And the focus now is focusing on using your biologics to repair your body and helping it heal itself. The future is here, biologics are here, and this treatment is available to all patients. We use several things. We use platelets, which are the smallest entities in red blood cells. They contain healing growth factors. They speed up the repair of tissue. And they also contain serotonin that calms pain down. And we use this in 2 forms. One is platelet-rich plasma, which we call super concentrated platelets for joints, tendons, and ligaments and cartilage. And this is typically used for mild osteoarthritis, not moderate severity or severe arthritis. We can concentrate platelets very differently based upon your needs, from anywhere from 3 times normal to 20 times normal, and create a custom treatment plan for you. PRP has growth factors that are released slowly. We also use platelet lysate. This is a lysed platelet. We freeze it, it ruptures, we filter it, and you have pure immediate release growth factor. And this is great for nerves. So we use it for people who have things like carpal tunnel or other nerve entrapments. And we also use it for people who have sciatica, as it seems to help and is neural regenerative. Let's talk a little bit about adult stem cells. These are called mesenchymal stem cells. They're undifferentiated cells that are held in reserve until they're needed. They can turn into many different types of cells. They can turn into bone. They can turn into cartilage, tendon, ligament, etc. The stem cells orchestrate repair. They are the concertmeister of regenerative treatment. They renew themselves so they don't go away when you put them on a surface. They can last probably up to about 10 years. And they also provide a new blood supply to the area that is important in providing extra nutrition to an area that was somewhat devoid of nutrition prior to treatment. And though when you're treating a knee, for instance, you do grow a little cartilage, the main reason that this works is we change the internal environment from one of breaking down to one of rebuilding. And so with rebuilding, you're changing the internal environment in that knee, and it continues to rebuild and improve. In our current situation, 80% of what we do is platelet-rich plasma-based treatment, 20% is stem cell treatment. There's a significant cost difference, and we find that not everyone needs stem cells. As I was saying previously, mild osteoarthritis, PRP, most tendon and ligament treatments require PRP, and certainly youngsters require PRP and not stem cells. And the conditions we treat arthritis, and that's primarily what we treat. And often the arthritis is bone-on-bone severity. People have been told they need joint replacements, and those are the people who come to us. We treat all sorts of tendinitis and tendinosis. We treat torn ligaments, meniscal tears, various types of spine pain, and various types of disc issues. And lastly, we do treat nerve damage, whether it's a damaged nerve in your spine or a damaged nerve in your arms or legs, like carpal tunnel. And we can treat bone fractures that have not healed. And the sites that we use stem cells and super concentrated platelets for are shoulders, elbows, hips and pelvis, knees, ankles, feet, and spine. And I do some treatment of temporomandibular joint disorders, so everywhere from head to toe. What's currently offered in standard orthopedic practice are the following: over-the-counter anti-inflammatories that are prescription, and opioids. Non-surgical treatment offered by orthopedists include steroid injections, hyaluronic acid injections, various types of physical therapy, acupuncture, chiropractics, bracing, etc. And then when you get to surgery, you're replacing and removing and repairing, and there are significant risks associated with surgical treatment, such as blood clots, infection, and even death. So we think there's a better way, letting the body heal itself. We believe that surgery will not be the dominant form of orthopedics in the 21st century. A great example is meniscal repairs, where 95% of the meniscal surgeries are removing the needed meniscus spacer, and therefore you're creating biomechanical irregularity leading to accelerated breakdown of the space and speeding up arthritis. So our belief is to stop cutting tissue out and inject biologic agents instead that can help heal tissue. So again, for those of you who are joining, I'm Dr. Paul Lieber at Regenexx Pittsburgh. I'm a physician trained in interventional orthopedics. And we're going to talk a little bit about interventional orthopedics. As you can see on the screen, there's an ultrasound on the left and a C-arm on the right. And we use these devices to guide our delivery of stem cells and platelets precisely to where they're needed. And again, we're trying to use less invasive treatment to avoid more invasive surgeries. So simple treatments, 95% of the orthopedic surgeons and orthopedic medicine doctors treat people with single shot injections into their joints. Mostly without guidance, some with guidance, and this represents 4% of the US physicians. But 1% of the physicians who do this treatment are orthopedic, interventional orthopedic specialists. And what we realize is that it's not just the joint injections that we do, but treating loose ligaments, treating tendinosis, stabilizing the entirety of the joint, which requires extensive treatment of the joint itself and multiple injections that will ultimately get you better and back to functioning as normally as you can. Some examples of orthopedic medicine, interventional orthopedics, is Julie on the left, who, this is her knee on the right side. You can see the big holes that are circled. But before she had treatment, she had 3 years where she couldn't weight bear on her knee. And then she underwent stem cell injection into the joint and into the bone itself. And the lesion that you can see, which represents dead bone, decreased in size, and she was able to get rid of her crutches and function normally. She now teaches yoga, among other things, and is doing quite well. Another example would be directing a needle into a site where there is bone edema, such as this person's kneecap, to provide stem cells into the area under X-ray guidance to deliver the stem cells precisely to where they're needed. Another treatment that we do is we treat anterior cruciate ligament tears. This is called the PERC ACLR, where we precisely deliver stem cells and or platelets to the anterior medial and posterior lateral bundles of the ACL in order to repair ACL tears. And this works quite well. We do this for athletes and people up to the middle ages. When older people have torn anterior cruciate ligaments, they often have no residual tissue to use to repair, so it doesn't work so well in them. This is another example of using your own stem cells. In the picture on the left, we are repairing a supraspinatus tendon with a gap measuring 1.3 millimeters. We can treat that area up to 1.5 millimeters and fill it in. And on the right side, you can see a person who, after 7 months, after 4 months, has filled in very nicely. I wanted to focus a little bit on spine. My background was interventional spine before I really learn to treat the entirety of the musculoskeletal system. So I'm going to talk a little bit about that today. Treatment is for irritated nerves, painful herniated discs, facet joint pain, ligamentous pain, spinal stenosis, and post-laminectomy syndrome. So this is a vertebral disc joint. You can see the vertebrae, the discs, and the facet joint. And as you age or you have specific trauma, the joint itself can become injured disease. You can develop lax ligaments. One of the things that we can treat is bulging discs, which encroach upon the surrounding nerves, and they can be effectively treated with platelet lysate. In this case, the facet joints become enlarged, hypertrophied, and push on the nerve sac again, crowding the nerves. And these facet joints can be treated with super concentrated platelets to restore their integrity. And lastly, there is this large ligament called the ligamentum flavum, which hypertrophies, and we can inject the supraspinous ligament, the interspinous ligament, and the ligamentum flavum to pull this ligament back out of the way a millimeter or two and give your crowded nerves more space. And so the whole procedure is called regenerative DDD, degenerative disc disease procedure. And basically you're treating muscles, ligaments, nerves, tendons, to restore the balance and integrity and stabilize the spine. The results: less pain, improved function, improved mood, you're off your pain medication, and you're back to your preferred active lifestyle. Do you get 100% out of these treatments? No, but usually it's enough so that you can enjoy the quality of your life once again. Usually in the case of a peripheral joint, we're going to get people into the good range, typically 70% or more, and that this treatment should last quite some time, years of effective treatment. This just doesn't have to be done over and over again. So experience, what does that mean? Why is it important? Regenexx has been doing stem cell and PRP treatment since 2005. That's 15 years. They've done thousands and thousands and thousands of treatments at Regenexx Pittsburgh. We've been doing this since 2012. We've done about 1,500 stem cell treatments and about 6,000 PRP treatments. So we know how to do this. So all the expertise that we have makes it likely that you're going to get a good result. Specialists. We are specialists in musculoskeletal care, trained in the specialty of orthopedic medicine, interventional orthopedics. Our backgrounds are often with residency specialty of physical medicine and rehabilitation. You're not having a chiropractor do this, a naturopath do this, a nurse practitioner, or a PA. This is doctor land, and you should have a physician who has expertise and is not dabbling in this. We do this type of treatment all the time. And when you have the right doctor doing the treatment, they're going to make the right diagnosis, and they're going to provide the right treatment, and your likelihood of success is much greater. At Regenexx, they do extensive clinical research. We participate in that research by providing data to their registry. They publish 50% of the world's research on stem cell treatment. So you know that they're gathering data and doing patient treatment with double-blind, randomized, placebo-controlled research studies. So again, you're going to know that it's safe, effective, and get the best result. When we harvest from bone marrow from your posterior pelvis. We know that getting approximately 5 to 10 ml per site gives you the most stem cells. You're going to get a higher dose harvested with the best technique and the least pain. We can count your cells. We know the viability of your cells, and it gives you, again, the greatest opportunity for success. Again, the cell source is mesenchymal stem cells from your bone marrow. This is the only treatment that is FDA compliant, so you should know that. Again, proper dosing from the bone marrow, and you get the most peace of mind results and value for the money you spend. Regenexx has the largest safety paper in the world, studying well over 2,000 patients. What we find is that this treatment is very safe, and that the most common issue is pain at the injection site that may last for 1 to 3 days. In Pittsburgh, for instance, our infection rate is 0. We tell people that we do a great job of sterility, but also your mesenchymal cells kill bacteria. So all important things. We like to take a holistic point of view in your treatment. We're looking up and down the chain. So for instance, if you have a knee problem, do you have a hip problem? Do you have a back problem? Do you have an ankle problem? What are the biomechanical abnormalities that need to be corrected? And how can we correct them? Aside from putting a needle in you, we may look at your muscular integrity, get you involved in physical therapy, look at your nerves coming from your back. Are they affecting the muscles leading to the breakdown of your knee or hip? So we're constantly looking all over to put you back together again in a comprehensive way. So a lot of this talk is you're getting to see a doctor on a webinar. How do you develop trust? And I've tried to impart my experience to you. I think it's very important for a patient to say to me, I trust you. I appreciate when they say that to me. And so what's important here is there's a lot of stuff that's out there. Amniotic, placental, cord blood, Wharton's jelly tissues, they're touted as stem cells, particularly by chiropractors. And there is not a single live cell. These cells have been, these tissues have been studied and they don't grow anything. And sometimes worse than that, if you look at Livion pure cord blood, tissue, it was infected with E. coli and injected into patients, and 17 patients got very sick as a result. So what these folks do is they look at university-based research on these entities where there are live cells, and they extrapolate, but their tissue is not live. It can't be live. You can't take a bottle off a shelf and have live cells, and you can't shock, thaw cells back to life. I've had the experience of working down in the Grand Cayman where they do cultured cells, and it takes about 48 hours to bring cells out of deep freeze, nurturing them with platelet lysate so that they can function once again. So a lot of this is just fraud. And I tell my patients that they were too old, and this is not true based upon reviewed, published data. Older patients using their own stem cells do no better or worse than younger patients. So old stem cells work, you just have less of them, but it's certainly enough to do one large joint, or one large and one small joint. And remember that the products that these people are touting contain either dead cells or no cells. Watch out for people who discount or put a heavy emphasis on financing. This isn't a magic cure-all. Everyone is not a candidate, and it's fraud to call amniotic cord blood, placenta, or Wharton's jelly as a stem cell. And right now, the FDA says adipose-derived stem cells are outright illegal. And the reason for that is that you need to wash the fat with an external agent called collagenase to get the stromal vascular fraction. And the FDA says, cease and desist, you're making a drug. So the Regenexx difference, again, when we're talking about a PRP treatment, you're going to spend an hour with a doctor who's going to talk with you, get a history and physical, review your diagnostic studies that you brought, perform a physical examination, and it's very possible that an ultrasound exam will be performed as well. There'll be a blood draw, and then later, the same day, there'll be an injection. Again, the initial visit and the blood draw are usually separated because we need to schedule the patient in for the blood draw and the use of our lab. But the blood draw and injection are usually a couple hours apart. And then we send you to physical therapy to help heal you. And we reevaluate you at 1 month, 3 months, 6 months, and 1 year after the treatment to make sure everything is going well. With stem cell treatment, the initial visit is the same 1 hour exam. Day 1 is tilling the soil, where we treat with a dextrose-based irritant in the joint. We strengthen and tighten ligaments. Most people go home feeling better than when they came in. Day 2 is typically a day or two, a couple days apart. We harvest your bone marrow and get the stem cells out of your bone marrow and then implant them in your injured body part, wherever that may be. So that's planting the seeds. Day 3, a couple days later, we fertilize the seeds. We draw your blood, and we send you off for an hour or so, spin it down and get your PRP and inject that into your joint. And again, the follow-ups are the same. Post-care physical therapy is prescribed for everyone. There are other entities that can be used. Some people say, I'm not going to physical therapy, I can't pay for the copay, and we will treat and prescribe exercises. There are programs like Pedagoscu that are helpful, and we can also send them back to their referring provider to prescribe therapy as well. Some people come from a long distance. What we found now is that there are some self-funded employers that are paying for Regenexx treatment. There are about 10+ million covered lives that have that benefit. And there are all sorts of companies, including Holist in Pittsburgh, that are paying for their employees to have a stem cell or PRP treatment. Why is that? Well, it's less expensive for the employer, but it also, the patients are happy. They're not having to have surgery. They get back to work in about 1/3 the time. So they're quite pleased with that. So how does it stack up? And again, I'm Dr. Paul Lieber from Regenexx Pittsburgh, for those who have joined late. Prolotherapy is the least expensive treatment we do. It's a dextrose-based treatment. It can be a standalone treatment. PRP, typically in the $1,500 to $2,500 range. Platelet-based spine treatments, typically from $2,500 to $6,500 treatments. per treatment, and stem cell treatments ranging from $7,500 to $9,500. So who is this for? It's for many people, those who want to avoid surgery, they want to keep all their body parts. They really don't have downtime for lengthy treatment and rehab. They want to get off their drugs. They've failed surgery. It's not unusual to see somebody who's failed a knee replacement who wants an alternative for their other knee. They know somebody who's had a bad outcome or comorbidity, where they've had an infection or blood clot, and they don't want to have that, or they have a medical contraindication for surgery, and some people are just plain too young to undergo surgery or joint replacement. But we see some young athletes who don't want to have surgical repair of the anterior cruciate ligament or the rotator cuff. They don't want the downtime and the debility from it. The consultations, the follow-ups, and the diagnostics and bracing are paid for, and the therapy are paid for by your insurance. Insurance doesn't cover the regenerative procedures, and with copays and deductibles, you may actually be paying more for traditional orthopedic than for traditional orthopedic surgery. We customize the treatment plans, and this results in a wide range of pricing. So no two people are the same. Our main site is in Pittsburgh at RIDC Park. This is where we do the procedures. We have satellite centers in Sewickley, Breedville, Monroeville, and Washington, PA. Contact Sarah Ferlin. You can call her at 412-963-6480 and schedule a new patient exam. So with that, I'm going to open this up to questions, and I'm going to step away for 1 second so that I can figure out how to answer the questions.
There is already one question.
There it is.
Mm-hmm.
So,
and I'll just keep that up, and I'll keep that up.
So, the pros and cons of hyaluronic acid. Hyaluronic acid is a treatment that often orthopedic surgeons offer, and what it is it's a fancy lubricant. There are no real downsides to having this treatment. The treatment can cause an allergic reaction, but usually not. Typically, it's a 3-part treatment done on a weekly basis. It can be done with guidance or without, and it usually can give people 6 weeks to a year of benefit if they have cartilage left. If they don't have cartilage, it's really not going to make any difference. It doesn't grow cartilage. It doesn't regenerate your joint. The next question, what is typical longevity of treatment? Partial labral tear. The longevity of this treatment, depending upon how severe the labral tear is, can be anywhere from a year to 6 years. If we use PRP and you're a young person, it can be curative. If you're an older person with a labral tear and it's degenerative, it's going to require stem cells. And again, this can last 6 to 10 years. So PRP or stem cells versus a cortisone shot. Cortisone shot is an anti-inflammatory treatment, and it typically is good for 6 to 8 weeks. Unfortunately, it kills chondrocytes, and the particulate matter in the cortisone injection degrade the cartilage in addition to killing the chondrocytes. So PRP or stem cells don't do that. They regenerate the surface. The PRP attracts stem cells into the area, whereas stem cells actually can become chondrocytes. So that's the difference. MRI required prior to treatment. For spinal treatment, the answer is yes, but more and more for peripheral joints, we're using ultrasound during our exam to determine whether you have a rotator cuff tear, for instance, and how large it is, or whether you have a meniscal tear and the size of it. We can appreciate the degree of degeneration better with ultrasound. But we really can't analyze the anterior cruciate ligament with ultrasound. So if we think you have an ACL tear, then we're going to recommend an MRI. So I guess the good news is we're recommending less MRIs than we used to. We do like to have a set of x-rays when possible, but there are still conditions where we recommend MRIs, and we will write for that the diagnostic study if necessary. The side effects and risks. Well, the main side effect is you're going to have some pain at the harvest site that lasts typically for 1 to 3 hours. And by the way, I've had both PRP treatments and stem cell treatments, so I know what they feel like. So for me, at the harvest site, I had about a half an hour of buttock pain. On the other hand, when you have treatment, stem cell injections in your knee or hip or shoulder, you can have 1 to 3 hours of pain. I'm sorry, 1 to 3 days of pain. Usually it subsides. Other side effects include infection. We've had a 0 infection rate. Again, the reason for that is your stem cells kill bacteria, and our technique as far as sterility is good, or excellent, I would say. Blood clots can be a possible risk of treatment. We've instituted an anti-blood clot program, and so for the last 3 to 4 years, nobody's had a blood clot. We use support stockings when you're talking about a treatment of a leg, like a knee, foot, ankle. We use support stockings. We give you post-procedure exercises, and we will provide you with some anticoagulant if you have a history of blood clots or there's a family history of blood clots. So I'll be glad to answer any more questions. I appreciate the questions that you've already asked me. And appreciate the opportunity to talk with you today. I can't tell at this point. Let me look and see. I don't see. There are?
There's no more questions.
No more questions. So again, I want to thank you all for being on the webinar. I'd be glad to see you. I think this is the world's greatest non-operative interventional orthopedic treatment that really can help lots of people.
One question did come through. They asked, what the youngest patient you treated with an ACL tear?
I think we've treated people as young as 14 years of age, okay, with an ACL tear. And interestingly, ACL tears are, when they're surgically repaired, they don't quite have the same biomechanics of the knee that they do when you're using your own ACL. So oftentimes people who have ACL repairs in their teens start developing arthritis in their knees 10 to 15 years down the road because they're not biomechanically moving the same way. All right, if I've answered all your questions, thanks for hanging out with me. Hopefully you found this useful. I really appreciate the opportunity to speak with you. Again, I'm Dr. Paul Lieber, a physiatrist at Regenexx Pittsburgh, and I'll be glad to answer questions if you think of them at a later date. We do Facebook Lives, and I will be glad to see you to do a consult. So thanks again, and have a great day.